If you're properly using and disposing of your prescribed narcotic medications, then you're part of the solution. If you aren't, well, that's a big part of the problem. Diversion of opiate-based drugs to the street is not only illegal, it's a major cause of hundreds of preventable overdose deaths in Ontario. This program will bring into focus what healthcare professionals and law enforcement in Oxford County are doing to reduce the harm of diverted drugs that are physician prescribed with the best of intentions for very severe pain relief.
We initially became involved, I think, in the fentanyl crisis because we had our first reportable number in 2013 in Oxford County. So 5 people died in Oxford County in 2013 from a direct overdose of fentanyl. So we came together as a community between myself, the pharmacists, and the physicians to try and create a program that would bring some of that fentanyl off the streets.
I think it is more an ongoing part of the opiate abuse. It first started off with OxyContin, as we talked about previously, where it sort of got put out to the community. More people started misusing the OxyContin. As OxyNeil sort of made its appearance and made it harder with the tamper-proof technology, tamper-resistant technology. Nothing's really tamper-proof, but tamper-resistant technology made it harder for people to abuse it. So they started seeking out other opiates. Hydromorphone became more popular. Fentanyl became a lot more popular. So we started recognizing more of the abuse aspects of it, especially in 2013, where we saw numbers in Ontario be that year, 476 people died in motor vehicle collisions, whereas 577 people died of opiate overdoses that year. So we've seen a marked sort of increase of opiate overdoses have happened. Fentanyl, one of the streamlining and one of our ways that we're sort of helping combat the misuse of prescription narcotics is through the Patch for a Patch program, where fentanyl is one of those products where when you're done, it actually has something that's left that you can return back to a pharmacy and have it checked, as opposed to other opiates where you consume it and the product is gone. It's small molecule drugs that have been absorbed by a body through your GI tract, and then it's basically in your body at that point until we get excreted later on. So that's the reason why sort of fentanyl. But it is an opiate abuse problem, and it's just a new part of the spectrum as we come along.
Okay, so tell me, what is fentanyl?
So fentanyl is a strong pain-relieving medication that is unique in that it is available in a patch format. Most of our medications that we take are something we swallow, are in tablet or capsule form, but this is a patch that is available to patients.
Is it new?
Oh, it's been on the market for as long as I've been a pharmacist, so well over 25 years.
And typically, who would be prescribed fentanyl?
It is for those patients who are suffering from chronic pain. So it's not for someone who's just fallen and tripped and hurt themselves, but someone who is in long-standing chronic painful situations that need long-acting relief.
So fentanyl, actually, it's under the Controlled Drugs and Substances Act where the charges actually happen. It'd be a charge of possession. Basically, when you have fentanyl, you need to have an authorization from a doctor to be able to have this prescription medication. A doctor's taken a look at you therapeutically and said that you need fentanyl for this period of time to deal with a pain or another area that you could have issues with that will sort of allow you to use fentanyl. During that time, you're going to have a prescription for it, which is an authorization. Without that authorization, without that prescription, that's a possession charge. If you were to come up to me on the street and you had fentanyl in your hand and you had no authorization, no prescription, no history of having any fentanyl, then that's possession, because these is very powerful opiate that we want to make sure that people are using it therapeutically. We just don't want misuse happening out in the community due to overdose and other problems that we see that way. With trafficking can be any sorts of things. So if you have a fentanyl patch and we're friends and you know that I'm dealing with pain, you were to hand it to me right now, that's trafficking. It could be something as simple as that to something that's more tiered, in which you see say organized crime is getting involved with it, with having large-scale forgery rings where fentanyl is trafficked that way and redistributed back out in the community. So it could be one of those sort of definitions for trafficking. But it's all under the Controlled Drugs and Substances Act, not under the Criminal Code.
It's not a commonly used medication, but it is something that we do dispense to our patients. So the fentanyl patch is provided as a 3-day supply. So it comes individually packaged and it is applied to a non-hairy surface area of the skin and worn continuously for 72 hours.
And then removed why?
Right. At that time, what we see is that the amount of medication is no longer consistent, and so a new patch at that time would need to be applied. So the trouble being is how to safely dispose of that patch. The issue with the fentanyl patch being, in order for the medication to be delivered at a consistent rate, there is still quite a bit of medication left over in the patch. Historically, we would tell people to take them off, squeeze them together, and either flush them down the toilet or throw them in the garbage, which are not the safest practices. We drink the water in the community, our garbages are going to landfills. So starting in North Bay, a fentanyl patch for patch program was started. Basically, it's a safe return policy for patients to be able to return their used patches to the pharmacy and then safely disposed of.
So at the public health unit, the fentanyl patch for patch program is just a small program within the health promotion department. In the substance misuse program, there's always many different things to look at, and a good strategy to have when looking at drug abuse or addictions is to have the 4-pillar approach of treatment, prevention, enforcement, and harm reduction.
And how are pharmacists and doctors and other health professionals at adopting this program? Is everybody on board with it so far?
So far, for the areas that we have moved through in Oxford County, everybody has been really receptive to the program and open to writing the patch for patch program on their prescriptions, and the pharmacists have been really engaged in assisting clients to bring their patches back.
So the patch for patch program is in the brochure here. Basically what happens as a prescription is dispensed with the number of patches, patients are given this brochure, which provides them with information and then allows them a spot to apply each of their patches. And so as they take off a patch, they would then apply a new one to their skin. The old one comes onto the brochure. Then as the brochure is used, they would bring this back to the pharmacy, and then we would take care of it from there. So the number of patches the patients would return, then in turn, based on the prescription from the prescriber, that's how many patches would then be sent out to the patient.
And what do the patients think about this program?
Anyone who's participated so far is happy to have somewhere safe to put those used patches and know what to do with them.
Ontario is it's a community problem for Ontario. The opiate issue is something that we're starting to see come right across the board. And each of the provinces, taking a look at the numbers from Stats Canada this morning, have seen a rise in the various opioid-related deaths over the last 5 years.
My experience is through the needle exchange program. So we keep stats on the drug of choice. So it used to be OxyContin before it was delisted in 2012, but we knew opiates were concerned. So we'd always heard a little bit about fentanyl misuse, but it wasn't really on the scene very much in Oxford County. So since the delisting of OxyContin, we have certainly heard much, much more about fentanyl being available in Oxford County and misused by our clients.
And it's made available through Diversion, correct?
Correct. Now, it's a prescription medication, so it has to be prescribed by a physician, but we do know that it's making its way onto the street.
What are you guys seeing mainly? Is it diverted prescribed fentanyl, or is it fentanyl coming in from places like China and places like that?
The majority of the ones that we're seeing in Canada is diverted from the regular sources, such as through forgeries or coming off people using these prescriptions and redistributing them back out in the streets instead of disposing of them properly. So we are seeing the fentanyl patches being put back out. What you're talking about with the illegal distribution of fentanyl, the clandestinely made, the powders, are ones we're seeing more out west right now. We're starting seeing in the East Coast as well. It's the ones that they're putting into Oxy 80 tablets to make it seem like it's Oxy 80, but it's really not. It's a product that's 50 times more as powerful. Or in a case in Durham recently where it's been cut in with cocaine as well to sort of have it that way. So we see the two different sourcing. So you have the illicitly sourced, and then you have the prescription strength, the ones that are found upon the fentanyl patches.
It was a pharmacy in Nipissing in the north that looked and had identified that there was actually an issue with used patches making their way onto the street. What we know is that because there is a substantial amount of medication left over in that patch, that unfortunately it was making its way into hands of people who it was not prescribed for. So all hosts of ways that it was being used, but unfortunately being used by people who are addicted to medications on the streets. And what we were seeing were then people unfortunately overdosing on these products.
And that pharmacy worked with public health in North Bay?
So there was, correct, so the prescribers, the pharmacies, public health. Nick Fideli is the MPP who is bringing this forward to the Ontario government. It has just passed its second reading in order to make this a legislated practice in Ontario. And the police is a big, big part of this.
Nipissing MPP Vic Fideli's Bill 33. It's known as the Safeguarding of Our Communities Act, which incorporates the Patch for Patch program, received third and final reading in the Ontario Legislature in early December 2015. The bill is expected to be made law in 2016.
We realize that enforcement is about one pillar that sort of deals with this overall opiate abuse issue. Part of it's education, which is part of what we do. We go out and we educate various members of the community, and we go out and various community partners as well. But as well, we know prevention is another one, and we work towards the monitoring programs that sort of come along as well. We deal with the aspect of, we're concerned about deaths because obviously it's public safety, and part of the job that we have is with public safety. Therefore, we work with our community partners to sort of come up with solutions, community-based solutions to help deal with these deals with this. As well, we concern ourselves with people that are profiteering off members of our community, such as trafficking. So people that want to turn a profit off people that have addictions that sort of come along that way. We realize people deal with addictions all the time, and there's services that are set up that way, and we have drug courts in London, Toronto, to help out with people that have addictions that might have found themselves within possession charges or trafficking charges along those ways to sort of assist with them. And they're very successful. We've had a few graduates actually come from the London courts now, and I believe one of the first women that graduated was actually from the Oxford area. So I mean, it's sort of good that way. We're but one component of this solution that comes along with the opiate crisis that we're sort of seeing in Ontario. And we know that. Enforcement is just one pillar that we do.
The problem sometimes with the opiate abuse isn't necessarily the crime of abusing non-prescribed opiates. It's generating the money to be able to buy those drugs, isn't it?
Well, and that's a side effect. So if addiction can really cost a lot of money, and if people are addicted and can't work, where are they getting the money from? And that sometimes impacts young people, absolutely impacts young people, because if their parents can afford to pay for simple things in school, where are the kids going to get the money to buy those things? School trips, food. Those are things that are important. So we're seeing now young people are acting out in different ways. So they're doing the vehicle entries and trying to get cash to buy things that really are basic needs based that their parents can't necessarily provide because they're so into the addictive cycle.
And so, I mean, is that what the fentanyl patch for patch, is it trying to sort of at least put a cap on one portion of this?
It's absolutely doing that. And it's sad, and I've seen in this community, and other community partners have seen young people overdose on fentanyl patches, and where are they getting it? They're buying it from somewhere. So at least it gives pharmacies, it gives doctors power to control at least one very dangerous, legally prescribed medication, and to hopefully make people more accountable so they're not selling it and our young people aren't getting their hands on it.
So in the neighboring communities, St. Thomas being one of them, Windsor area, Guelph, the neighboring communities and counties have been participating in the program, and through that we have been having discussions with our prescribers and pharmacists and our patients about safely disposing of this medication.
And how is it being adopted by the actual prescribers, the doctors?
It's been a fantastic uptake. It's something that a few of prescribers were starting to initiate with their patients, whether there was concern or just the discussions in having the medications returned. So unanimously, in all the physicians we've been meeting with across Oxford County, as well as the pharmacies, everyone has been excited to get on board and participate with the program.
I would think that responsible people would see this as a good thing, but I think there are those people that are in that the drug culture where they may sell their patches and make decent money to provide for family. So what can we do as community partners? We need to make this program successful. We need to get this fentanyl off the street level, and we need to support these families so they're not relying on the criminal element to make money to provide for families.
How big of a problem is fentanyl, do you think, in Woodstock?
I would say that if there's any tragedy at all, and we've seen it in our community, so people that overdose on fentanyl patches, young people overdose, that's a problem. It could be one person. That's a problem.
Some people may think that you're babysitting them.
Oh. It's not about babysitting, it's about keeping our communities safe. We all have children that live, and we all live and work in our communities, and if we can help keep the medication into the hands of the people that require it, but help maintain the safety network, is what is important to us.
And how are you working with other pharmacists to roll this program out?
So we've been meeting with all of the various pharmacies and following up with them. We provide all of the written materials that they need. They're available on the Oxford County Public Health website, and creating a network of discussion together.
The drug fentanyl, along with other opiates, have the side effect of slowing down breathing and heart rate. In overdose situations, it can mean no breathing and no heart rate. Combining fentanyl with other drugs or alcohol makes the risk of death even greater. Oxford County Public Health has been on the vanguard of the use of an opiate overdose antidote.
In our health protection department, we have, for some of those harm reduction programs, we have a Naloxone program and a needle exchange program. We work in a lot of partnerships with police and pharmacies to help with the enforcement. Part of that strategy, and we're always working with Addiction Services of Thames Valley, the Woodstock and Area Community Health Center, and anybody that is providing treatment to those who are looking for help.
So naloxone is an antidote for an opiate overdose. So it's given in a situation where someone has overdosed on an opiate, their respiratory center has been depressed to the point where they can't breathe. If they're injected with naloxone, it bumps the opiates off the receptors, and the breathing center is re-stimulated, and the person starts to breathe again.
Most people don't overdose with a doctor present, so who is able to administer this drug?
So this program is meant for people that are using opiates or at risk of an overdose, so misusing opiates. So they are the first responders. They are there with people while they're misusing and can intervene immediately. So people can come to the health unit and get training for this program, and they actually go home with a kit that has 2 doses of naloxone. And if they witness a peer in an overdose situation, they call 911, but they also inject the naloxone, because time is of the essence with an overdose of opiates, because the respiratory center is depressed, so you're losing brain cells, etc. So damage can happen even if the person doesn't die. So getting the naloxone in as soon as possible is really important.
When was that program initiated in Oxford?
So it was initiated in 2013, January 2013. We were the 5th health unit in the province to adopt the program. It started out west in Winnipeg and kind of moved, sorry, can I change that? Mm-hmm. Started in Edmonton, actually. Okay. And Toronto was the first health unit in Ontario to do this program, and then we in Oxford were soon followed. And part of the reason was that through our work in the needle exchange program, we knew that opiate misuse was high on the list of the products that people use because they're addicted to opiates. And we knew there was a need for this program because people were dying of an opiate overdose.
In Oxford County?
In Oxford County, yeah. The Naloxone program is meant only for those at risk of an overdose. So it's a prescription medication that I'm delegated to provide the training to clients who are at risk, meaning they are using an opiate. And after the training, they can take this prescription medication home. Hopefully it will be broadened so that people like family and friends that might be witnessing their family member overdosing could actually take the training and have a kit of their own, or hopefully in the future police might be carrying naloxone. So the sky's the limit, really. We want to get naloxone out to the people that need it. The wider it's spread, the better.
Oxford County Public Health has implemented many programs that reach out to drug abusers in an attempt to reduce harm and risk.
So we have a needle exchange program. It's a mandated program within public health, and it's been in operation since 2000. It's grown quite significantly over the years, and it's a place where people can come and get clean supplies, sterile supplies, syringes, spoons, water, in order to reduce the spread of infectious diseases such as hepatitis C and HIV. But it's also an opportunity for often our more vulnerable population to have access to healthcare providers, because often we are their only access point. And it's about building relationships with people that are more vulnerable, and talk not just about needle use and addiction, but other health concerns. And we're also an access point to treatment or other services.
You're not just giving away needles, you're actually talking to people.
Exactly,
and
building
offering.
relationships. And I think for me that's even more important than giving out the needles, because like I said, we're seeing a very vulnerable population that really don't feel comfortable going many places. So we have people that have abscesses on their arms that don't want to go to emerge because they're concerned about the way they'll be treated, or have a chest infection. It sounds like they have pneumonia, but they'll avoid going to the doctor until the very last minute because of the way they're treated. So here they have the opportunity to be treated in a respectful manner, non-judgmental, open environment with a healthcare provider.
Drug court would have been the communities within London and Toronto are sort of testing it out right now.
Okay.
London OPP, London police are involved with that as well, and people get diverted out to different courts. Same with Toronto. People sort of get identified that this might be an addiction issue that's fueling their different criminal activity.
Let's talk about that then just a little bit. I mean, that's one of the things that you're working with community partners, and the community partner would be the community in trying to successfully divert people out of the
cycle of addiction. So you're trying to get people out of the cycle of addiction. These drug courts are people that are identified at that point as people that may have addiction issues that are spurring on the criminal activity. And what happens is the community sort of recognized that and came up with drug courts. So people are diverted towards these drug courts to help deal with their sort of addictions and see if that sort of diminishes the criminal activity that they're involved with. And they go through counseling, they go through other facets of the community to sort of system with that way.
And that would just be some of the resources at the OPP.
That is. So let's, in the Oxford community, if you're a person that lives here in Ingersoll, you could take a look. First thing that we divert into it is patrol officers that go through. We educate our patrol officers on what the various drugs look like. So it could just be that they showed up to a high school sometime and have come across a drug. And even that, a drug that nobody has any idea what the potential could be for a kid, if it was a fentanyl patch or if it was another prescription narcotic, could be in the hands of somebody that's not tolerant towards that or have no idea what might affect their actual body chemistry. So we have patrol officers do it. We have a local community drug action team member that works out of the Oxford area, which we have in all our communities, that go along, and they're people that are more specialized in drug investigations. And we put those aspects out towards the community as well to sort of assist patrol officers that come in with a little bit larger scale drug occurrences that might come in. As well, with the OPP, we have the drug enforcement unit, which is out of the Organized Crime Enforcement Bureau, that kind of oversees some larger investigations that go on in Ontario, but as well are involved and active in a community level as well. If that community drug action team member needs further assistance on warrants or needs help with further investigations, then we divert resources towards that. As well, we got great community officers that come out and educate our young on drug activity and drug, sort of the DARE programs that you see come across, and do the education that way. And media as well. If we know that there's an issue that comes out in the media, such as fentanyl, our media officers take time to sort of go through and educate the public as well on what fentanyl is and some of the things they can look for. And even when the Patch for a Patch program comes out, our media officers sort of come out and help out with those types of promotions.
I became involved in the program because I was faced with a prescription from a prescriber that stated they wanted the patches to be returned. And at that point, I had always dispensed patches in a nice foil package. I had never seen a used patch, and at a time when patches were to be returned, it became evident to me that I needed more experience with this. So luckily, being in the community we are, knowing a few people in the St. Thomas area who had started the program, thought this is something we can get on board with. It's about keeping our community safe for me.
Because 577 people is a lot of people to die due to opioid overdoses. And the same as we're concerned about people on the roads that are dying as well. I mean, we put in distracted driving laws to sort of assist with that. Legislation is being looked at for the Patch for a Patch program to allow that to sort of come forward and people return their patches. It's a community-based problem that we are part of. We want to be part of the community-based solution to it. We know we can't arrest our way out of this problem. There's no way we can. Every police force knows that. We know part of it's through education, part of it's working with our community partners, part of it's, you know, our facet is people that are profiteering off it, doing the types of trafficking investigation. Patch for Patch is great to be involved with because it was started off as a community-based solution out of North Bay. And it was a community that got together and sat back and said, we have this fentanyl problem, how can we help deal with this? And we adopted that with the OPP through North Bay, sort of allowing us to go through, and we've copied that program in various communities. Essex, Lambton has one now, Guelph, Wellington area, Middlesex has it, Elgin has it. We're just in Oxford community now has it, and it's one of those facets we look at. And it was a community-based solution because it just seemed really simple. You have fentanyl patches, you use them, you're able to return it, just like you would dispose of other narcotics you don't use at the pharmacy. And as well, it starts up the open dialogue between the pharmacist and the doctor. If there's a patch missing, that's a dialogue the pharmacist has with the doctor, not necessarily with the police. We don't necessarily but we champion this because we are concerned about members of our community. And having those powerful narcotics, something that's 100 times more powerful than morphine, left out in the community, that anybody would have the ability to. It doesn't stop from people dumpster diving, going forth until they found out you had a fentanyl prescription, trying to see if they can get used fentanyl patches from your garbage. We've had instances of that. And we've found that this is a way of sort of a proper disposal. The same the reasons why we do prescription drug drop day in May, to make sure that all those narcotics are properly disposed of as well. So that's why we're involved with Fentanyl Patch for Patch. It's a great program, and it allows us to work with public health. It allows us to work with the doctors and the pharmacists of the community as well to sort of deal with an issue. And starts up, you know what, another thing, it starts up communication like we're doing today. It starts up that conversation of recognizing that this is a problem that we have as a community and looking for different avenues that comes out. And out of those conversations, sometimes even better ideas come out of it.
Now that a fentanyl patch return program has been instituted in Ontario, what of all the other opiate-based medications that are being diverted to the street? Maybe the time has come to consider all forms of narcotics being formulated into a transdermal patch. For Rogers TV, I'm John Payne.